Good morning, hopefully good afternoon from some of you who are joining us from far away. And thank you for joining us today in our online seminar. So getting EUDAMED right, a practical hands-on guide. This will really be a hands-on guide, as you'll be able to see during this presentation. So yeah, I hope that you can really answer all the questions, and let's see a little bit of practicality on what EUDAMED actually is, and make sure that you're getting it right. My name is Carla. I'm the Sales and Marketing Director at MDSS. A little bit about today's webinar. So as you can see, we are being recorded. The webinar will be shared to all participants together with the presentation slides. The webinar will also then be shared in our website, so you can always watch it later, even if you're not have access to it directly, but you'll receive an email directly after the webinar ended with the recording. If you have any questions during the webinar, so I will be moderating the session today. So if you have any questions, and we really want to have it a practical, interactive webinar. So any questions you might have, feel free, write them on the chat or on the Q&A. I will keep an eye on it. I will interrupt our speaker if I see that the question is related to the specific, if there is some break. Otherwise, at the end, we'll have a couple of minutes to answer all your questions. But if you want to ask a question also live, just please raise your hand. I will bring you to the screen, unmute you, and you can ask also the questions directly to the speaker, and we can have a little bit of more interaction. So don't be shy about it. Keeping in mind that it will be recorded, so anonymously, if you want to do the question also on the Q&A, that's also a possibility. Now a little bit about MDSS really quick. We are MDSS GmbH, based in the headquarters in Germany, more than 30 years in business. Our services in-country representation and regulatory consulting services, and we are ISO certificate also. And so in-country representation. So next slide, please, Patrick. Thank you. Not only in the EU, where we are headquarters, but also US, UK, Switzerland, Australia, our new openly office in New Zealand. And we also support some other services that are related with registration, in-country registration, and CE marking. In terms of consulting, not only in the EU, but also via our US office, so anything related with the EU MDR, EU IVDR, but also FDA support, and very important, the EUDAMED support that we are going to be discussing in today's webinar. MDSS is also a founding member of several organizations, so the EAR, the European Association of Authorized Representatives, the UK Association, Responsible Person, a little bit different name, also from Swiss MedTech as a member, MTWA in Australia, and we are a long member and supporting in terms of sponsorship of the RAPs, not only the US, but also now the EU side of RAPs, and we were one of the founding members of the German chapter. Today's speaker that I will introduce now and will take from me in a couple of seconds. So Dr. Patrick Pili is with MDSS since 2020, 22 something, 21, I believe around that.
Yeah.
Yeah, 2020, exactly. Thank you, Patrick. He currently leads the EUDAMED service at MDSS, so that's why he's doing this webinar today. He was previously Director of Verification and Registration Department also at MDSS, and he harmonized all these verification requirements across the EU, UK, and Switzerland, so that to support our clients in the most efficiency and least burdensome approach that we try to implement at MDSS. And very important, on behalf of the European Association of Authorized Representatives, he's the member of the EU Commission, the MDCG working group on the EUDAMED database, of course, since February 2024. So, and with that, I welcome Patrick, and I will give it up to him. So feel free to pose your questions. I will keep an eye on it, and I hope really to have an amazing seminar. Patrick, up to you.
Yes. Thank you, Carla, for the kind introduction. And with that, welcome everyone from my side as well. It's great to see a a high number of participants. And I think it just shows that EUDAMED is really a key topic in this year's when it comes to medical device compliance. So EUDAMED, I'm sure I don't have to introduce the background of it. So in very short, it's the European database on medical devices that was implemented in the frame of the MDR and IVDR. And I'm sure that most, if not all, participants are related to a medical device manufacturer. And that is why in this webinar, we will focus on the obligations of medical device manufacturers in EUDAMED. And on a side note, whenever I talk here about manufacturer, it also includes assemblers of, or producer, as it's called, of systems and procedure packs. So when medical devices are put together to be sold as a kit, that's a usual term for that, also those producers of that kit assume EUDAMED obligations and have to register themselves and devices. The ACTA registration, so where the company has to register the entity in EUDAMED, already applies since May 28. If that has not been done yet, the company is effectively in non-compliance and the ACTA registration has to be done immediately. The focus of this webinar is the device registration and also the registration of system and procedure packs. This, for any new devices that are introduced to the market, meaning that are added to the device portfolio after May 28, so after May 28, 2026, they have to be registered before being placed on the market. This also applies to legacy devices that achieved their MDR certificate after May 28. In order to place them on the market as MDR compliant, they have to be registered in EUDAMED as MDR compliant. However, the majority of devices that are placed on the market have been placed on the market since a long time. And for those devices, the deadline for registration is 28th of November 2026. So in just about 4.5 months, which is not much time left. And in our webinars and also in our day-to-day business, we are happy to see that EUDAMED is rising in the manufacturer's attention. The manufacturers start to realize that EUDAMED is and has become a key part of compliance. And I guess this is what is intended by the Commission and by communicating that particular deadline. So at latest on November 28, 2026, all devices that are sold on the European market have to be registered in EUDAMED. And the question that we often receive is then, okay, how do we do that? Because one is for sure, if there's no EUDAMED registration in regards to the deadline, we are talking about non-compliance with all potential consequences. And our answer when we are asked how could we do this best is, in our view, includes the first step, which is to draft one device registration in EUDAMED, to actually know what is required, to know which information about the device has to be entered, and maybe which information is missing in the technical file and has to be first checked what would be the answer for the device registration in EUDAMED. And with that, officially, I welcome you to this webinar because this is exactly what we will do today. We will dive into the EUDAMED device registration process step by step and see what will be asked from the database when registering a device. And it's sometimes funny because a frequent question is, or what we see is, that actually the website of EUDAMED, so the starting page, seems to be well hidden. Because when you Google EUDAMED, you see some websites that are not actually the database. And the first takeaway and useful takeaway from this webinar is maybe the website address of where the EUDAMED website can be bookmarked to land on the landing page. And when you are here, you enter with your EU login account. So the thing that we will skip in this webinar is the actual ACTA registration. So in the frame of this webinar, we will assume that the company, the manufacturer, is already registered, and we will just focus on the device registration of an MDR device. So after the login, the home screen looks like this. That's the home screen, and here at the button, we see different tasks that can be done. And importantly, those two buttons lead to the registration of a new basic UDIDI, meaning the registration of an MDR compliant device, or the registration of a legacy device. And noteworthy, also legacy devices have to be registered at latest until November 28, 2026. The same deadlines apply to MDD, IVDD legacy devices. The next frequent problem that we see is that those buttons are missing. This has something to do with the user rights of the user that is logged into EUDAMED and can be solved very quickly in 15 to 20 minutes by upgrading the profile. So if you do not see those buttons, just let us know and we fix that on a shared screen with you in 15 to 20 minutes. So when we click on the button to registering a new basic UDIDI, we will be brought to this window. And I guess on the next 1 or 2 slides, the information that is entered relates to the basic UDIDI level. And as most of you will know, the basic UDIDI is usually assigned to a group of devices, to several UDIDIs. And on the next 2 slides, the information that we enter has to be valid and correct and applicable to all the UDIDIs that is covered. And in a second, we will figure where this could be a challenge. But first things first, the applicable regulation is entered, whether it's an MDR or IVDR device. Then up next, the issuing entity and the basic UDIDI are entered. And here, a common challenge is that the basic UDIDI entered is not correct. It's not valid. So there has to be a specific layout that has to be fulfilled by the basic UDIDI that is entered. And this layout will be validated by EUDAMED. It's not the only one, but a common issuing entity of the basic UDIDI is GS1. And because of that, we included here the link to the GS1 basic UDIDI validation tool. The next information entered is whether or not the device is a system or procedure packs in regards to Article 22.4, and whether or not the device is a kind of a special device type, which includes software, and the rest are device types that are contact lenses and spectacles. Those device types, the soft contact lenses, the contact lenses and the spectacles are listed here because they fall under the master UDI scheme, which is, to be honest, a quite different, or could be it deserves its own webinar 1 hour long. So we will not focus on the master UDIDI topic here. But software already has led to a problem in one case where the manufacturer had a medical device software and a medical device hardware covered by one basic UDIDI. And here we see that this is not possible because we have to answer the question for a basic UDIDI whether or not it is a software or not. So here it becomes clear that software and non-software devices can't be covered by a basic UDIDI. And this makes sense because the basic UDIDI groups devices that fall under the same risk class and the same device essential design and manufacturing characteristics, which are, of course, fundamentally different between hardware and software devices. Once we are done here, we click on Save and Next, and then we are on the next window, still asking about basic UDIDI information. In case the manufacturer has more than one authorized representative, it will be asked which authorized representative is mandated for the basic UDIDI that is to be registered. After that, basic information like risk class and information like whether or not the device is implantable have to be answered. And those questions usually are straightforward, and they usually do not provide any problems and challenges. In contrast, the following information sometimes gives a headache. And it asks to indicate the device model or the device name. So one of those two fields has to be filled out. If there's no device model, and it is toggled to no, a device name has to be entered. And the usual question is, what do we enter here? And one problem, or you could frame it as a chance and freedom to choose for the manufacturer, is that neither device model nor device name are identified. So whatever you use in your technical file and on the labeling, what we see here is a device label, whatever you use to indicate the name of the basic UDIDI devices can be entered here. So if the declaration of conformity indicates device model, for example, power device, and it's also on the label, indicate power device. But especially here, it can be a challenge to find a name that is common across all UDIDIs that are covered by the basic UDIDI. And in case it's not possible because the model names or the device names are different across all UDIDIs, it is okay, and that was confirmed by the European Commission, to just enter a generic device description that fits to all covered UDIDIs at the field of the device name, kind of a fallback clause. But in general, if possible, it is recommended to indicate device identification, so trade name, and later on we come to further aspects like they are on the labeling, to allow easy finding of the device in EUDAMED, for example, by the importer. He usually sees the label. Once we solve that hurdle, we come then to step 2. It is grayed out here because we are registering, in this example, a Class 2A device. And interestingly enough, certificate information, so the notified body at least, only has to be registered for devices that require a product certificate and not the usual quality management system certificate. So we are talking about high-risk class devices, for example, Class 2B implantable that are not well-established technologies, and Class 3 devices. The same goes for IVDR. We are just registering Class 2A here, so this step is just skipped. And we directly proceed with submitting UDIDI information. So from now on, we really talk about the specific UDIDI. First thing to indicate, well, is the UDIDI, and also here it has to be according to a specific layout, which is validated by EUDAMED, and also here GS1 provides an online validation tool for the UDIDI. If the UDIDI was entered by a different entity, then also this would have to be selected here. But so far, we have not came across a case where this would be applicable. The next up is to indicate the EMDN code, so the nomenclature code under the European Medical Device System that applies to the device. It can be several. And what you see here is the publicly available EMDN database where an applicable EMDN code can be selected. It has to be the lowest level, so the most detailed EMDN code that applies to the device. After that, trade name. And here, a little bit the same goes like for the basic UDIDI model or device name, which is it should match the labeling. if the labeling shows a word that the manufacturer considers as the trade name, it should be entered yes, and it should be entered here. EUDAMED asks if a trade name is entered, what language this trade name belongs to. It is not required to translate a trade name. Yeah, the trade name is usually something that is just made up by the manufacturer that sounds good. And it's not required to translate the trade name. But if on the labeling that is sent to the different member states of the European Union, if the trade name is translated, then the different translations will be asked from EUDAMED. But if the trade name is not translated and it's the same on all language labels, it can be selected that that name is used for all languages. Indicating the reference catalog number is usually straightforward. Just match the information that is on the labeling and then indicate whether the EUDIDI labeling is directly marked on the device. This means permanently and physically. It does not mean a sticker or just where the labeling is affixed to the device, but it really means that the EUDIDI label is kind of imprinted, so permanently and physically on the device. After that, the quantity of devices is to be indicated. This means the selling unit that bears this EUDIDI, how many devices does it contain? So one example would be you have a box of medical gloves. The box bears the EUDIDI that is indicated here, and the box contains 100 identical gloves. This would mean to indicate 100 at this point. If a unit of use DI is required and is used, also this would have to be indicated here, like the type of EUDI product identifier. So during manufacturing, as devices are manufactured, what kind of product identification takes place? Is it via lot or batch number or expiration date or serial number or manufacturing date? It is possible to indicate several methods of product identification. Just mirror what is done on the EUDI label. The next thing is additional product description. And at that point, I would like to point out that for all the information that we talked about so far, we have this red asterisk indicating mandatory information. It's missing here, so it means it's optional information. Maybe there are cases where the manufacturer should consider to indicate additional product description. Our starting point when we provide consulting is don't enter anything unless that is optional, unless there's a really good reason to do so. Because the text that is entered here is free text. And in EUDAMED, every time free text is used, the language has to be selected. So if it's the English text, it has to be indicated English. And now comes the kicker. When a device is placed, for example, on the French market, and we know the official languages of France is French, then the French authority may expect that this free text in EUDAMED is also translated in French. And when we consider I don't have the exact number, but I guess is more than 20 official languages that apply across the European Union, you can imagine that for a device that is made available on all European markets, this particular field and other following fields that have free text and require translation potentially is an additional workload. So try to avoid, if possible, entering free text. Last year also sometimes brings up question marks, is to indicate the status of the device. But the easy answer is if you are registering a device, and I would assume devices shall be registered now that are to be or already have been placed on the market and are still being placed on the market simply indicate on the EU market. Save and next. Next information about UDI, DI characteristics, which is the clinical size. And here a little bit of a disclaimer. The clinical size is not defined in the MDR. Not defined. So it's up for interpretation. What does clinical size mean? So the question has to be answered whether or not clinical size is applicable to the device. And here's one interpretation. The interpretation is a clinical size is a parameter that relates to the intended purpose of the device to distinguish it from other variants of the device. And when we want to find out whether or not the device could have a clinical size that is clinically relevant to its intended purpose, we usually check the labeling. And in our example, we have the diameter and the length. The question is, why does the manufacturer place it on the labeling? Supposedly because it shall tell the user some information. And most likely because that information is important for the user, for the proper use of the device, to distinguish it from the other variants that have other diameters and length. So it could be argued that this information on the labeling is a clinical size because it potentially is related to fulfilling the intended purpose of the device by the user by the user. So in this case, we would enter the diameters and the diameter and the length that are indicated on the labeling. And it's done by selecting the parameter in the pull-down menu and then to indicate the size and the centimeter. If a device that you want to register does a parameter that is not included in this list, then there's a fallback, which means other. So you select other. It comes then with the disadvantage that a free text has to be entered. And you remember what I said about free text a minute ago. And the same potential problem comes also in, I think, on the next slide. But first, easy one, labeled as single use, whether or not the device is labeled as single use. And if it's not single use, if there's a maximum number of reuses applicable. So does the device have a maximum number of reuse as backed up by clinical evaluation and risk analysis? Does the device need sterilization before use? And is it whether or not it's labeled as sterile? Straightforward, easily answered usually. Whether or not the device is containing latex and whether or not the device is labeled for the presence of carcinogenic substances. Now comes a thing that is quite similar to clinical sizes to indicate whether or not there are storage and handling conditions and or critical warnings or contraindications. Also, those terms are not defined in the MDR. But if the labeling is showing, for example, those harmonized symbols keep dry, most likely is considered a storage condition to keep it dry. And our approach when we do a EUDAMED registration is we check the labeling because the labeling is understood to contain the information important for the user, for example, in regards to storage and handling conditions and critical warnings. The labeling shows to not re-sterilize the product, the device, could be considered to be a critical warning because it's so important that it's on the labeling and most likely should tell the user, well, to not re-sterilize because it would come with risk if it was re-sterilized and used. Also here, the pull-down menu can be selected or used to find the storage and handling conditions and the critical warning. It's a long list. And so far the list mostly contained all the warnings and handling conditions that were required. But also here we have the fallback. We have two fallbacks actually. The first one being to indicate, refer to instructions for use. So if the instructions for use has those warnings to use that particular field, that option. The other fallback again is other, which then requires free text. Save and next, we are not yet done, but close. The next one is to indicate whether or not the device is reprocessed single-use device and whether or not, this is just in rare cases, whether or not the device is a device not because it has an intended purpose, a medical intended purpose, but because it falls under Annex 16. So rare cases, special devices. Now comes an interesting one for manufacturers that become manufacturers because they're purchasing a device and put their name on it. So manufacturers that become manufacturer in virtue of an Article 16 NDR, for example. If there's an OEM, so original equipment manufacturer, then this question should be indicated as yes. So the requirement is, according to EUDAMED, is the device designed and manufactured by another legal or natural person? And if yes, to indicate the person, the entity, the person, and if that entity is also in the registered in EUDAMED, to provide the SRN, so the single registration number. And in the webinar on Tuesday, it was a very interesting point when an attendee pointed out one conflict within the regulation. So EUDAMED says, and also Annex 6 of the MDR says, that here persons have to be indicated that design and manufacture the device. So both, that do both actions. The conflict is with Article 10 NDR that requires that the manufacturer has to indicate persons that design or manufacture. So one of both. This is a conflict in the legislation, and our recommendation for the manufacturer is use this conflict to your advantage. Maybe you have reasons to rather not identifying your suppliers in EUDAMED. So consider this conflict, make your own interpretation where there's room for it. If the device was object to a clinical investigation or performance studies for IVD devices, indicate it here and indicate the identifier of the study. The presence of tissues and cells of human or animal origin to be indicated, usually that's a straightforward thing. And if there are substances that are, if they were not included in a device, would fall under to be a medicinal product, has to be indicated here. And if those substances are present in the device, the international non-proprietary name has to be indicated. So the name of the active substance has to be indicated here. Now comes a section that shows that which will be reason for the maintenance of the device registration. So we are meeting today because the registration has to be done now, right? But with time, the registration has to be of the device has to be maintained. For example, because of this. So first, the country where the device has been first on the market has to be indicated. So in which European country was the first unit of that device placed on the market? It is indicated. That does not require maintenance, but the following does. For all devices except MDR class 1 and IVDR class A, the countries have to be indicated where the device is made or is to be made available. So the different member states of the European Union. It's mandatory to indicate the countries. And EUDAMED will ask from when to when the devices have been made available on the market. Those dates are optional. Indicating the dates is not required, and you can imagine this can be a particular piece of workload if you start to indicate the dates and kind of checking the records, delivery records, check up with the importers. So maybe there are reasons to indicate the dates, but it's not required. And now there are different approaches of how to and which countries to indicate where the device is available. The first approach is the exact one. Indicate the countries and only the countries where the device is or is to be made available and keep it updated. That's the most exact one, and that's potentially provides the most maintenance efforts. But it's also possible to indicate simply to click all countries. So select all countries, even though maybe if it's not the case. This can be done, and it has the benefit that the device is indicated to be available in all countries, and EUDAMED is public. So EUDAMED most likely will be used by your potential customers. They will look for, particularly in the encode, for example, which manufacturers do provide the products that I'm interested in. And when they will see that the country where they are sitting in, that the device is available on that country, it may lead to sales for you. So it can be a visibility booster to indicate more countries than, according to our records, are actually supplied with the device. The disadvantage of selecting more countries than where you know the device is actually supplied with is in case there's a reportable incident. God forbid, yeah, we don't hope that, but in case a device causes an incident in France and all authorities of the member states have access to the vigilance data. And if the authority in Sweden, for example, sees that the device is indicated to be available in Sweden, whereas it is not, but it's indicated in EUDAMED, then it may be that the Swedish authority will reach out regarding questions about whether or not, for example, devices and how many devices have been shipped to Sweden, in case if there's any, so any potential surveillance actions that could then be asked by the authority. So different approaches here, do your choice. Forbidden is none of them. It's basically of where the client where the manufacturer wants to position themselves and how visible they want to be. Last thing of the registration is optional to indicate container packages. So if the UDIDI has higher levels of packaging, they require their own UDIDI. And those UDIDIs of the higher levels of the container packages can be indicated in EUDAMED. That's the final piece. Once this button, the submit button, is pressed, there is usually no way back. So for all devices that do not require a product certificate, so class 2A, class 1S, class 1, and the respective risk classes in the IVDR, the registration will be immediately public to everyone. Every layperson can check up EUDAMED and see most of the device data that we just talked about. Devices that require a product certificate, class 3, for example, the registration will be sent within EUDAMED to the notified body that will confirm the registration. After they confirm the registration, the device will be public. An interesting thing, most of the information that we talked about after the submission is logged. So in case there has been a mistake, for example, it was indicated that the device is implantable, whereas it is not. Quite fundamental thing. It is not possible to correct this after submission. The only way of correcting it would be to discard the registration, so effectively deleting it. Deleted registrations will forever be visible to authorities and to the manufacturer, but they will see all records, even if devices have been discarded. And this applies to most of the pieces of information that we talked about. And when we asked the European Commission that this is a potential problem because, mistakes happen, then their position so far has been, yeah, you just have to be careful before submitting. Well, yeah. However, the Commission also acknowledges that it is a problem, and they communicated that they are working on a solution to allow easier or updating more information than it is at the moment. However, at the moment, most information is locked after submission. Once the submission has been done, you will see this window and you will be asked, do you want to enter another UDIDI to the basic UDIDI, or do you want to register a new basic UDIDI? Next steps. So now we went through a draft registration, and of course we can't cover all potential questions and device types. So bear with us that we could not cover 100% of devices or questions that could come up for particular device types. But in general, then we covered that. The next thing is to maybe draft a registration for your particular device to see what maybe other questions will arise, and then to identify and gather the information from the technical file. So maybe there are pieces of information that are not yet curated in the technical file. So find them out, bring them together to then know, okay, what to enter in the registration for the device. And then to know that every UDIDI, meaning every variant of device, has to be registered. And depending on, and in general, EUDAMED has different ways of the registration. So what we did in this webinar was the manual registration in the browser window, entering all the information. And if we have 10 devices and they all have the same information, except for different UDIDIs, different scatter numbers. Unfortunately, and that's the biggest flaw of EUDAMED, it's not possible to copy paste them. It's not possible. If we have 10 nearly identical variants, we have to do the registration process that we just did, one after another. After some registration processes, I would consider that it usually takes, and if the information is available in an overview, Excel spreadsheet or similar, I would estimate that one registration of one UDIDI takes maybe 3 to 5 minutes. And if you have devices, 500 UDIDIs, then you can do the math, how much workload will come with that. There are two methods of bulk registrations. And the XML upload is the one the Commission intended for scopes like several hundred, 500, 600 UDIDIs. For portfolios beyond that, it's the machine-to-machine interface. We will not touch now those solutions, but just one thing, it's not easy to implement the XML conversion and more difficult to implement the machine-to-machine solution. We have had manufacturers that started with thinking, okay, we will create XML files on our own. And they came back to us and said, not possible. Because the XML is a difficult thing, because the EUDAMED conditions for working XML file are very complex and have to be followed exactly. And this is usually where third-party providers come into play, because third-party EUDAMED providers usually have an IT background, and they have the technical and IT solutions to enable bulk registrations. So effectively, EUDAMED created a new kind of service provider, which is EUDAMED submission. Further resources. So one of the users submitted the question where to find more information. Well, here are the links for step-by-step user guides. It's basically what we did today. The EUDAMED help desk is here. The contact form can be filled out. They usually respond very quick. Often enough, the information, the first response still requires some clarification, but at least they are quick in responding, which is good. And they also earlier this year, I think it was last year, they had webinars several hours long about each of the modules in EUDAMED, and they published the videos on this link. I just said EUDAMED just created its own new consulting service with helping manufacturers doing registrations, especially doing bike registrations. And we, MDSS as trusted service provider, of course, set it up so we can help. MDSS as authorized representative has been doing device registrations throughout the last 30 years. Device registrations were our core business. And so for us, it was just logic to continue and apply our experience with helping manufacturers and actually do the registration for manufacturers and help them with making the deadline 28th of November. And with that, I close. And have fun with the EUDAMED journey. Reach out to us. And for now, of course, we have, I think, sufficient time to address any questions.
Thank you, Patrick. Yeah, it's a lot of information. So thank you very much for all the details that you provided. A lot of fields, a lot of really mandatory information that needs to fill out in each screen. So yeah, it's a workload that manufacturers needs to really to be prepared. But like Patrick said, we can support with that as authorized representative. At the moment, we cannot do that on your behalf, but our sister company, MDSS Consulting GmbH, is supporting client and non-clients, AR clients that MDSS has. So yeah, feel free to reach out for us. This will probably change when the proposal that was submitted last year in December, published by the European Commission, the proposal will change that. So the authorized representative will be able to do the registration on behalf of its clients. That's what's happening in Switzerland with EUDAMED. So the AR, we are the one performing the registration on behalf of our clients. The same for the UK, the same with TGA in Australia. So I think it makes sense to EUDAMED also to provide that option, and hopefully that will change next year, if I'm being positive. Let's see. So yeah, now to the questions. Patrick, we have a question. Is there a way to remove discarded UDIDI records if you have added incorrect information and need to create a new record for the same UDIDI?
So discarding, the way to do it is discarding the UDIDI, which is basically to remove it from the database, but still the record will be kept and will be available for authorities, and to you. But once that has been done, the UDIDI can be reused. So you can, if you have indicated the wrong information for the UDIDI, discard it, and then you can do the registration from scratch. One limitation to that, it currently is not, it can be the case. So the discard function is only possible until the UDIDI is linked to another element in EUDAMED. For now, the only way of this, how this could happen, would be when the device, the basic UDIDI, is linked to a certificate, to a product certificate in EUDAMED. So once that is done, it can't be discarded. And later, once vigilance module comes into play somewhere next year, it's not yet defined when exactly, once the device registration is linked to an incident report within EUDAMED, that will be also a case where it will be not discarded. So I think for now, the recommendation is after submission, of course, check the information before submitting, right? But it can't be wrong to check the information after submission, because that will be still the time when it's safe that it can be discarded, because it's not yet linked. And again, still maybe in one of the next updates or updates during the year, EUDAMED will change this lock of information. It's possible. So they, as I said, they announced that they will provide more options to change information. So what I'm saying right now applies now, but may be object to change because EUDAMED is still not finalized, and I think never will be, because there will be always kind of updates and new functionalities, also based on feedback.
Yeah, thank you, Patrick. Yeah, another of the attendees, so he missed a little bit this part in the ask. It's why it's not recommended to use the free text, for example, in additional trade item information or in the clinical side. You didn't really catch that. I know that you were clear, but you can go again about that. And then I will give, after your regulatory perspective, then I will butt in and I will give a little bit of marketing perspective, but go ahead first.
Yeah, of course. I focus on the regulatory thing, and marketing definitely comes into play when it comes to EUDAMED. So the first rule is information that has to be indicated in EUDAMED has to be indicated. And for if there's information that is a clinical size, that is defined as clinical size, then it's required to enter it in EUDAMED. And if there's no option, if there's no clinical size parameter available, like size, length, volume, that fits the clinical size that has to be entered, then the fallback has to be used, because the obligation is to indicate the clinical size. So then the free text, the other option that will lead to use of free text, has to be used. There's no way around it. And maybe there are also reasons to, in the field that I showed previously, to enter information in the, just have to see where it is, in the additional information field, like here, additional product description. This field is completely optional. But maybe there are reasons where the manufacturer really thinks, okay, we should enter something here. We have to do it. Maybe in the frame of risk analysis. Maybe there's something where entering information here is one way of a risk mitigation. Could be. The only thing that we are saying is, if free text is used, then authorities may expect that their official language is used and written there if the device is on their market. Before going that, talking about it, I missed that earlier. One quick word about Switzerland. Not in the EU, third country. If the device is to be made available in Switzerland, likely you know that there's EUDAMED, the Swiss medical device database, where the device has to be registered, also with deadlines. And how it works, and EUDAMED does it well, is EUDAMED can use the device registration information from EUDAMED. And one thing here, if the EUDAMED registration shall be the basis for registering in EUDAMED, and free text is used with the languages, the official languages of Switzerland, which is German, French, and Italian, have to be used. So it will not be a problem to list not all of them for European market, but EUDAMED, Swissmedic will require it. Just to keep in mind when also EUDAMED is part of Switzerland is part of the picture. I've missed that earlier, but yeah, Carla, marketing.
Yeah. So
Sorry.
from the regulatory perspective, it can be a hurdle to have additional information about your product that you want to provide, to have in the several different 20-something different languages that exist in the European market. However, from sales and marketing perspective, think that, like Patrick said, this database is available for everyone. For your clients, your healthcare facilities, your distributors that may want searching to buy your product, final consumers. And this can also be a way to advertise your product, advertise specific that only your product does, so that you really want to advertise that. However, also please keep in mind, this is also available to your competitors, this database. Your competitors can also check this database if they have a similar product to you to see what is being on the product description. So advantage, disadvantage as always, but please, keep that in mind, that whatever information you put here will be available for everyone to see. So marketing, regulatory aspects sometimes clash. You have to find the middle ground that everyone is happy. But we have a couple more questions, Patrick, so we still have a couple of minutes. So the date of first place on the market can be in the past. and should be realistic date, correct?
Would be a realistic date.
And it can be on the
I
in the
have
past.
to. I
place
have
on the
to.
market.
I would consider yes, but I have to confirm that. I would. I have to confirm it. Whether a date in the past can be selected. So could you maybe reach out via email and we get that question solved? Or Carla, do you know of any way of how else? At the moment, I'm not. Can't tell, but we'll.
We'll get back to you. Yeah, I will
Please reach
send you an
out.
email. Yeah.
Yes.
To Patrick,
Sorry.
and then we'll contact you with that information. Yeah. So how to manage additional markets? The products are
one note to that. One note to that.
So,
as I said in the web, it's not required to indicate the date. It's not required. So it's optional information. But if, of course, we check if it's possible to enter a different past.
Yeah, but it's optional. I think in terms of dates, for vigilance, maybe it's something that can be used. But other than that, the advantage of putting dates, I think it's more workload than actually any advantage that you take from that. But yeah, it's up to everyone. Okay. How to manage additional markets. The products are placed on the market by a distributor in Spain, but the manufacturer is not aware of this. Oh, this awesome. We also had the discussion. Yeah, and our manufacturer stated the date EUDAMED registration. That is not correct. Stated the date. Okay, it's the same person. So Patrick, you can then reach out to her. But yeah, these additional markets that the manufacturer is not aware. This is a very, we had also this discussion that EUDAMED is trying to regulate business. Yeah. That is also something that it shouldn't happen. And like you said, manufacturers may not be aware where the product is being distributed, because you have 1, 2, 3 importers, can have as many importers as you want, and you have no control to where the importer then places the product, further makes it available on the European market. So you are not aware, so you have no way to knowing it.
And that's okay.
Information.
That's
exactly.
Okay.
So Patrick,
it's not a requirement, not an obligation to have control over importers to check where they are selling to. No obligation. If you know, as I said, the market availability, the country for the higher risk classes, class 2A and so on, the country should be indicated. Also, we talked about just select all and have that kind of overpower it. Yeah, but again, no concern in that.
Yeah. Okay. Thank you, Patrick. Yeah. Then you can have a one-to-one conversation with them and get a little bit more in deep on that.
Let's talk.
Okay. So last question. Let's see. We still have 1 minute, 2 minutes to go. Our IVDD products are still on the EU market, and they are the same as the IVDR ones, okay, which have not been placed on the market yet. In this case, should we register both IVDD and IVDR products because it's the same product?
Yeah, great question. Gives the opportunity to talk about the legacy MDR thing, because the same applies for MDD MDR thing. So if the MDR certificate, IVDR certificate is not expected in the next months. Yeah, and I would go even more beyond. If the certificate is not issued and available in the next 2 or 3 weeks, then I would just recommend to go ahead and register the device. Because the rule is, if the IVDR certificate is not issued until November 28th, so meaning the legacy devices will be continued to be placed on the market beyond November 28th, they fall under the deadline. So you can play safe and say, register now. You have to register until November 28th if you intend to place legacy devices beyond November 28th, because you want to have continued sales, right? You want to have to make use of the legacy provision. And then once the certificate is issued, then the IVDR, MDR registrations have to be done. So what will be is you do the legacy registration now, and once the certificate is issued, you register the MDR, IVDR as well. It's separate registration. So in the beginning, what I showed there's the process of registering legacy, and there's the process, it's a different process, a little bit similar of what is asked, but also a little bit different to register regulation devices. One aspect to that, if you have the IVDR or MDR certificate already, or you expect it very soon, if the legacy and regulation devices have the same device identification, and with that I mean UDIDI, if the legacy and regulation devices have the same UDIDI, or the same catalog number, or the same trade name, the regulation is quite nice in this regard. They have a wide definition of what means the same identification. Then it is sufficient to register the regulation device. It is sufficient to register only the regulation device, even though both legacy and regulation are placed on the market. Further, we can go different strings from here, but it still can be possible. It will be required still to register the legacy device if there is an incident to be reported next year. So, I think we can leave it at that. So I think the recommendations have been given. If certificate is to be awaited, will not be issued anytime soon, register legacy now.
Okay. Thank you so much, Patrick. Yeah, I think, 2 minutes over time, but I think we are still okay. So last words, really key takeaways, really understand EUDAMED terms, that's important, avoiding pitfalls, streamline submissions so that you ensure compliance, and that we are here at NDSS are here to support you. And we always try to do the least burdensome approach that we really try to implement. So if today's session has raised any questions, feel free to contact us, get in touch with us, and we hope to see you on the next upcoming webinars. There will still be one more probably before the deadline hits. Yeah. Let's see how the trend is going until there. But yeah, again, start today. Patrick, any last words? Really?
No,
deadline
not really.
Here.
And just for the relevance of it, the regulation foresees that the importer, so your customer, has to check EUDAMED. So we had cases where the customer called us and said, or called the manufacturer, said, register in EUDAMED, and you don't want to have any regulatory concerns on side of your customer. One reason to do it even way before the deadline.
Exactly. Yeah, and consider that there are already some discussions that since October and November will be a no month for really EUDAMED registrations. Like everyone was going to try to be registering, so it will probably we'll see some crashing of the database, the same that we saw in the UK when the deadline hit. So keep that in mind. But yeah, again, we are here to support. Thank you all for joining us. Hope you had a good time, and we hope to see you soon. So have a nice day. Thank you.
Goodbye.
See you next.
Until next time.